Professor Aliyu Abdu, a nephrologist at Bayero University Kano and consultant at Aminu Kano Teaching Hospital, has revealed that at least 651 kidneys were illegally harvested and transplanted in Nigeria between 2015 and 2020. Speaking at a seminar on organ and tissue transplantation standards in Abuja, Abdu estimated the global value of the trade at over $41 billion. He linked Nigeria's role in the black market to weak enforcement of existing laws. The National Health Act of 2014 prohibits the commercial sale of human organs and requires donor consent, but Abdu said implementation has been inconsistent, leaving the poor and vulnerable exposed to exploitation. He warned that many donors suffer long-term complications without medical follow-up. Most of the people who fall victim to this are poor and desperate. They are lured by money without understanding the health risks, he said. According to him, the illegal trade is sustained by criminal networks involving recruiters, medical professionals, drivers, travel agents, and insurers who facilitate transplants. Abdu stressed that the absence of cadaveric donations and the lack of functioning organ banks in Nigeria continue to fuel demands for illegal kidneys, worsening the crisis. 675 kidneys illegally transplanted in 5 years. What are your thoughts on this report?
The system is really going down. Now, my concern is I'll borrow a leaf from Karl Marx and Hegel's assertion of there should be no class certification. There should be no bourgeoisie, neither the peasant and the president. Everything should be, everybody should what? Equal right. Class. Now, my concern is that the level of poverty in our country, level of poverty in our society is inflating on a very is on a hike. So my concern is that the government should put an major eye on. Now, when we talk about basic amenities, right. The health sector is one. The paramount sector that we cannot overlook. Right. So there should be a level of checks and balance in that health sector to know that who is because I for once I'm a linguist by profession, so I cannot do a kidney transplant. So even if 100 persons, 1 million persons come to me, they say, as a linguist, please go into a kidney transplant to the coming years, 100 days to come. I will not do that. I can't do that. So it is people in the health sector that are doing this, that are bastardizing the process. So now, this is coming from also from the health sector that are doing this. They should check inwards. They should look at who are the persons in doing this and how can they apprehend these persons, and the law should take it course to ensure that no matter anybody that comes to say, okay, that he wants to, because of money or not, that he wants to for kidney transplant, no, you should show this. Issues like this should be a delicate issue whereby this is life and death. Maybe you want to save a life. It should be based on saving a life, not based on business adventure, not based on making fame, not based on that based on the situation. The government situation is not smiling at anybody, so nobody should use that as a yardstick to say he or she is adventuring into such kind of business. So it is totally wrong, totally appalling, totally fermented. Right.
Now, if you look at the dynamics of what is going on with this particular report, you find out that there is an illegal trade for a black market. We are currently in a society where people are being kidnapped regularly. Actually, there are some backdoor stories as regards people saying they were kidnapped and, people were killed while being kidnapped in the place they were kidnapped at. You see skulls. And do you think that this black market has extended further, further into the society where some people are not going to say, oh, I'm poor, so I want to give out my kidney. But now people have dug deeper. There was a case of a girl, I think somewhere around the NTA, that was killed by her boyfriend and her kidney was harvested. A long story. That was done by a medical practitioner. Like you said, it is from within. Do you think that this black market scope has now moved beyond people willingly offering their kidneys to be taken for money? and it has extended to the point where people now actually buy these kidneys from people that were kidnapped and killed.
Now, getting it, by and large, whichever way we are seeing it, it still comes from a medical practitioner or someone, either whether you're half-baked medical practitioner or you're a professional. Because harvesting this process, a layman cannot adventure into that. It is not the level of whereby you go to the market, you get a catfish or you get a bird and you start cutting. No. It goes beyond that. So now, the government, the government should be proactive in the sense that our security agencies, what are the level of their proactiveness to issues like this? Okay, how far have they been able to tackle kidnapping, insurgencies, and all lot of insecurity activities? That's on one part. Then on the other part is that the health sector.
Right.
How far are they on their own part, but making sure that this does not, there's no leakage from their own part, from their own perspective, from their own
because this transplant is still being done by doctors.
It is done by doctors, it's done by nurses, it's done by people who have these ideas. So no matter what, they should not be a half-baked system. So the system should not have any leakage from any part. So the government should work intermittently in pursuit with the law enforcement agencies and these medical practitioners to ensure that this does not come into play.